Hang on. I have to having some tech difficulties. Okay. Let's see. Okay, I have to exit out. Sorry, guys. I'm just having some tech stuff. My slides won't advance. Let's see here. Okay. I may have to leave and come back in because I'm having some tech stuff. You talked me through.
Yep, you did it. We're just here for support.
Oh, you're awesome, Angela. Thank you so much. You need to be my phone a friend for tech. Thank you for your patience, all. So welcome to the third Family Child Care Rules Advisory Committee. Thank you so much for attending these meetings and providing your feedback. We know that this is an additional time commitment for you all after your busy work day. My name is Carol Peterson, and I'm going to be facilitating this session tonight. And I want to quickly introduce the other DELC staff in attendance. Abby Strom, who will be monitoring the chat and answering any rule-related questions. We have Allison Delory, who will be taking notes and documenting your feedback for this meeting. And we have CCLD Regional Manager for the Salem office, Carrie Hudspeth, who will be our timekeeper. And then we also have Ronnie Pham, and she is here just as a support. So just a quick reminder, for transparency purposes, this meeting is in webinar format, and all comments made either verbally or typed into the chat are considered public record. To ensure all input and voices are heard, any comments placed in the chat will be read aloud. So please double check your message setting on the chat feature. Confirm that it's set to everyone so your comment displays correctly and is included in the meeting recording. So tonight's agenda looks very, very similar to last week's agenda. We're going to review the group norms and family child care RAC scope. We'll review the feedback and responses from the previous meeting. We'll dive into the rule text review like we did last meeting. We'll take a break about 60 minutes in for 5 minutes. And then we'll pick back up with reviewing more rule text and then closing comments. So as mentioned in the previous meetings, at the beginning of each RAC, we'll start reviewing some standard group norms. And those norms help guide us throughout our time together and ground us in the work that we will be focusing on tonight. So we want to allow opportunities for all voices to be heard, want to take space and make space, remain focused on the scope of the RAC, be open for respectful discussion, encourage and honor individual perspectives and truths, use the raise hand function or chat for comments, practice active listening, and seek commonality. So this slide indicates the scope of the Family Child Care RAC. So as we review the rule language, some guiding questions that relate to the RAC scope are the rules identified as having a fiscal impact accurate, and are there additional resources that may be needed for implementation? Are there any unintended or potentially negative impacts to specific groups or communities? Is the rule language clear enough to understand the intent of the rule? And are there any unintended consequences of the rule change or addition? So in the next couple of slides, we're going to be reviewing some key changes based on your feedback from last meeting. As I mentioned before, the rules are being reviewed internally as well. So many of the spelling or grammatical errors have been addressed and some suggestions are still under review. so they will not be included in the follow-up information presented tonight. In addition, some rules have been removed from the draft set, and if the rule was removed, you will see a strike through on the rule text indicating that removal, and I'll be highlighting any of those changes during the meeting. So with that, we are going to start with the feedback from the previous meeting. So we did have a comment about a question about immunizations. When it's dealing with a provider being able to provide care for children who are in foster care or experiencing homelessness. The suggestion we received was to be more inclusive to situations and add children who are experiencing a change in guardian or permanent residence. So we looked into that, and the accommodations for children experiencing homelessness and are in foster care, and this is specific to immunization, it's a CCDF requirement. So at this time, we will not be altering the wording. However, we are researching out options for some of the other comments that came in about exclusion dates and the reporting requirements. We are going to reach out to OHA to provide additional training and technical assistance to providers regarding immunization reporting and exclusion guidelines. Under the record retention, there was feedback that the cross references that were listed in the rules were confusing. And there was a question of whether there was an easier way to write this to locate what requirements this rule was referencing. So the wording in this section is still under revision, but we are working on a way to better clarify the requirement. We're also exploring adding links within the online version of the rule book when references to other OARs are used. So that was one other suggestion that came out from last week, and we are exploring that to see if that's a possibility. So under record retention, there was a question about electronic records. There was feedback that clarification was needed on which records need to be portable in an emergency. So the rule language has been clarified and will include child and caregiver records and current day's attendance for certified family, and then children's records and daily attendance for registered family to help provide a little clarity in terms of which records need to be available. Under the items available for review, there was a suggestion about can this be written to state only when their child is present? And this has to do with a notice that custodial parents have access to all childcare areas upon notifying the provider or caregiver. The other suggestion was, can this be a required posting and not just be available in a binder? So we took that to the rule committee, and the rule language will be updated and will include during the hours their children are in care. And additionally, the notice that is required to be posted contains the statement that custodial parents have access to all childcare areas. So this information will actually be posted as well as possibly in a binder. In the central background registry section, we discussed about ADUs or alternative housing units, tiny homes, RVs, and the small a where those residing in or visiting the living space are not suspended or have not been denied or removed for cause from the CBR. So the feedback we received is that providers may not know if someone's residing in or visiting the living space has been suspended or denied in the CBR. So the wording will be revised to read, those residing in or visiting the living space are not known by the provider to be suspended or to have been denied or removed for cause from the CBR. because we do recognize that people visiting or residing, you may not know. And so we did make that alteration to the wording. And one final suggestion came about regarding the substitutes. The substitutes was listed, this language regarding the substitutes was listed under the duties and qualifications of assistants. So the feedback that you provided was that this seemed out of place in this section, and can this be moved under the provider section? And yes, and we made those adjustments. So thank you so much for making that suggestion. So if there are no questions on the information that I just presented, I want to transition us to reviewing the rule sections listed in the rule notice that I emailed to you. Like last weekend, we will review, or last meeting rather, we will review each section of the rules, focusing on equity and fiscal impacts, as well as unclear rule language. As you may recall from the previous meetings, many sections are worded exactly the same between registered family and certified family rules. However, in this meeting, in order to streamline the review process a little, if the sections are worded exactly the same, we will not be reviewing both rule sets. However, if there's any difference in wording, even a minor difference, both rule sets will be presented for feedback. We feel it's vital that the information is reviewed through your lens, since each of you have a unique perspective on how these rules may impact you. For this meeting, we will be closely monitoring the time and have allotted 4 minutes per rule section, so the opportunity for verbal comments may be limited. To ensure we keep within that time frame, a reaction will be sent in Zoom that you will see approximately 30 seconds prior to transitioning to the next section. And Carrie, if you want to try out your, there you go. If everybody be looking for the little floaty reaction. So this is going to alert everyone that the opportunity to provide verbal comments will be ending, and comments that have been placed in the chat will then be read. If you are not able to provide your opinion, please use the feedback form that has been included in the emails that I've sent you. And as mentioned last meeting, we review each piece of feedback received either through the feedback form or through comments provided during the RAC meeting, and each hold the same weight of importance. So with that, I'm going to transition us to our to the notice with the rules, and we're going to start with that. Last meeting we didn't get through all of our sections, so I'm going to pick up where we left off, and I'm going to be focusing on certified family this time, since the majority of the rules contain the same, the ones that contain the same verbiage, they are focused on the certified home. So with that, with the volunteers, we do not have a section for volunteers under registered family. And this section is exactly the same in which we currently have in the certified family rules. So I'll give you a second to review. If there's no questions or comments, I'm going to move us along. Some of the sections tonight are going to be fairly easy, and they won't have a ton of comments. Okay, so I'm going to move us on. This section has to do with the orientation and initial training. This section is quite similar to the registered family home section. The only difference is in the registered family home. It does state about the introduction to Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Registered Family Part 1 and Part 2. Introduction to Regi We do have a template to capture all of this information. And I do want to call out that we did change biocontaminants to bodily fluids. One additional call out here is the addition of and prior to having unsupervised access to children. Doesn't look like there's been any questions. Okay. So as I mentioned, the registered home is exactly the same, except for this, the Introduction to Registered Family Childcare Part 1 and Part 2. That is a required training that people need to take in order to receive their registration information. But otherwise, everything is exactly the same. So if there are no questions that have come in, I'm gonna switch us back to certified home. And we're going to transition into the annual training. The highlight here is substitute providers and substitute assistant twos who provide care for 240 hours or more per licensing period do need to take training. We raised that from 20 hours to 240 hours in order to better support providers who have to have substitutes come in and out. And I'm going to transition us to the registered home rules section. This is the ongoing training. So one thing I do want to call out is that CCLD is no longer requiring prorated training for reopen applications. Okay. Doesn't look like there's any questions yet. Comments? Okay. Well, that's a good sign, I think, huh? So this section covers training criteria. One thing I do want to point out is that we did put in rule that the provider and all caregivers employed must have an active account with Oro. However, an Oro account is automatically created once somebody enrolls in the central background registry. We did remove this 1 hour of training in the category of health, safety, and nutrition under the initial training requirements because it is not an initial, it's not required for initial licensing. Okay. If there are no questions or comments, I'm going to move us. Okay. The one thing I want to call out in the registered home is that we changed the allowance from every 5 years to every 3 years for people to be able to take the child abuse and neglect and have that count for training hours. And this aligns with all other license types. Let's switch this back. This section covers children in care and caregiver to child ratios. I'm going to have you read through this section and then I'll show you the chart that goes with this section. We condensed down 3 ratio tables into 1 table so that it's much easier for people to go ahead and review and not have to figure out based on 3 different ratio tables. One thing I'd like to call out is that we now have in rule that the 6-week-old age requirement does not include the provider's children. Previously, that was in registered home rules, but not in certified home rules. So people had to file for exceptions for their own child. Yes, Angie.
So I'm looking at number 3 that you were just talking about, and it does say, 6 weeks of age. Is there a way that we might be able to add some verbiage that if the child is in foster care, that we could take them younger? Because foster families aren't always able to take off 6 weeks when they get a new baby out of like the NICU or out of the hospital.
So there are always opportunities to file for exceptions for those type of kind of situations that may come up like that. And you can work with your licensing specialist to discuss the particular scenario and see if you can get an exception. But we can definitely take that back and look at it. Yes, Annalise?
Yeah, Carol, I just want to back you up on that. I've had exceptions to take children younger than 6 weeks when there is some sort of circumstance.
Great.
So
Thanks,
yeah, no,
Annalise.
I've always found it pretty easy to get that exception as a matter of fact.
Yeah. Yeah, definitely. That's good to hear. Angie, is that a new hand or an existing hand?
Yep.
Okay.
Sorry,
Sarah's-
I thought I lowered it.
Okay.
Okay,
It's
thanks.
okay.
And Sarah?
You may have just talked about this while I was trying to find my raise hand feature. For number 3, if it's the caregiver's child is under 6 weeks, does that count in ratio?
Not until they become 6 weeks.
Great,
They're
thanks.
considered childcare child. Monica?
Sorry. Yeah, so perhaps maybe adding it into the verbiage, something like exceptions include, or something about exceptions in that verbiage. That way it's clarified that there could be a possibility of having under 6 weeks of age.
Okay. One other thing I'd like to highlight
Oh.
is this section that if infants are in care and sharing the same activity area, Prior to this rule set, we did require some group size division. So the written plan does take the place of requiring groups of children to be separated as required in the current certified home rules. This change was in response to provider feedback received stating that group separation does not work in a home-based environment. Okay, and Annalise, the sign just went up do you have a comment or a question?
Yeah, I was just gonna ask, has there been any thought, I was gonna put in the comments because I realized we were running out of time in the chat. Has there been any thought given to multi-generational homes where the provider perhaps has a adult child living in the home who gives birth, and then that adult child has that their own child in the child care? I mean, in the home, right? So there's a 1, 2, 3, 4, 5-week-old baby in the home that is not the provider's own child, but is in fact a household member?
Boy, I can't speak to that. Abby, do you know? I mean, we can put that in the notes.
I think we'd have to put that note. So are you asking if that child could be a childcare child or
No, I just,
because
it
I
has
don't
come up,
if
it has come
if
up
the
in the
parent is
past.
there, if the parent is there, then of course they're responsible for their child, so they wouldn't be
Right.
yeah.
So that's been enforced. I know we're out of time. It has been enforced against childcare providers. I have thought that in a findings review, actually, that it wasn't the provider's child, and so it counted in the numbers, but the child was too young, and then and so there was there's been a couple of issues over the last 8 years so I'm just saying
Okay.
we may need to take a look at that.
Okay, great. And we will. So here is the ratio table. This is a ratio table that condensed, like I said, condensed down three options into one. This is much easier to review really quick. Number of children under the age of 2, total number present. If you had 16, you have 4 caregivers. So it makes it much clearer than how it was before. We're running out of time, but I am going to go ahead and just quickly review here, children in care. This has not changed. And this is for registered home. Any comments or questions in the chat, Abby? Great, okay.
There are a couple just about how it's been a long day, and some people are agreeing that it's definitely been a long day.
Thank you. Thank you. I appreciate that. So now you'll understand why I'm kind of a little scattered. I want to transition us into supervision. So, one of the main changes is that kiddos need to be within sight and or sound, or caregivers rather, need to be within sight and or sound of children at all times without relying on audio or video devices. And then we did put in certified home rules that when children under 36 months are playing outside, a caregiver must be outside supervising the children. And we did put in about sufficient light as well as background noise. One other thing is that I want to call out is when caregivers are in a separate room from children, the doors need to be open wide enough so that caregivers can easily step in the room to do frequent audio or visual checks of the children. Yes, Fernanda.
Yeah, I just want to ask a question that we have in our group all the time, and we always go to ask for licensors to see what applies. But the sight or sound, when you are alone, you don't have another person with you, you're the only adult with the kids, and you, for example, a kid has a potty thing and you need to take them to the bathroom. My bathroom is very integrated in my house, so I can hear everything, but there are other providers that their bathroom is a little farther, so they use a camera to still have the sight, but they cannot hear them. And I hear that some licensors said that that's okay, but if the rule said that, that's very confusing. Also, there are some questions when providers need to go to the bathroom themselves, and some have been told that they need to keep the open the door, which is not private, and that's not okay with the kids. So there's a lot of confusion about that, and there's a lot of questions that I always hear, and everybody has their own opinions on that. So I don't know, like maybe just keep an idea when there's just one care provider, and if the video in some circumstances applies or not, because this is something that I hear all the time, and there's a lot of questions and there's a lot of misinformation about this.
Okay. That is great feedback. And this supervision is basically the same for registered home and certified home. So I did highlights when things were exactly the same between the two, and a little note here that says same rule language between both sets of rules. So we will just be reviewing this section. So this section, this is a new section, and it's creating a health. So we have already captured the missing Y there. Should be healthy climate for children. This, like I said, is a new section, and it aligns with other rule types. This section is truly fundamental for promoting healthy caregiver and child interactions, and it helps promote children's feeling of safety and security when these actions are followed. So it is an opportunity to strengthen that and provide some guidelines for new providers, especially, so that when they're just entering into the profession, it helps them understand the importance of these rules. Okay. Okay, we're going to transition into program schedule and activities. And this talks about developing and following a written daily schedule. But understand that these schedules allow for flexibility. In the certified family rules, we do call out particular developmentally appropriate activities and experiences. So these are samples of what you can have. I also want to call out about the screen time. So the screen time rule for preschool age and younger has been reduced. However, for school age, it remains the same. And the difference between the two age groups is based on feedback we received from the work group. Angela.
Yep, had to find my mute button. It's all of us tonight. Yes, I just was wondering if there might be a particular reason why you don't just list a particular age instead of saying preschool age, just for the purpose of clarity. Like, could you say, 4 or younger, 5 or younger, whatever you consider preschool age?
So I'm
Or
gonna
five.
let Abby address that question.
So we define preschool age in rule. So
Okay.
it's in the definition section. And so and preschool for us is 36 months through age 5 or up to age 5 or eligibility for kindergarten. And so generally speaking, it's ages 3 to 5 for us.
So
Six,
would you need to call out a rule for children under 3?
we would say toddlers, if there was rules specific to toddlers, and you'll see coming up that there are some rules
Okay,
specific to
perfect.
infants and toddlers, and then even some for school age as well, which is 5 and up, or
Awesome.
eligible for kindergarten, including the summer months before.
Got it.
Yeah,
Okay, thanks so much.
you're welcome.
Angie?
So in our program, we allow children who are school age that do online education versus in brick and mortar to be here. They obviously go over the 10 hours of screen time a week. Would we now need to be required to ask an exception to allow children to be in our program that the parents are utilizing an online education form? It is
So
a public education.
We do have Be Here that can be extended for projects and homework. So that would most likely fit in under that category for school age kids.
So maybe we need to have some clarity so that all licensing specialists understand that online education could fall under usage extended time.
Okay, great suggestion.
There is one question in the chat, and Sarah says, does number 6 read that all of those activities must be included, or that they can be selecting what is preferred? And I believe the word there, we're at the 30-second mark too,
Yep.
is must. So that would be a requirement that activities are available that cover those interest areas.
Mhm. We haven't quite gotten to the registered home yet. Largely the same, but just pared down. So we've got the screen time. We have just daily routines. And again, like certified home, we have the ensure daily outdoor play for each child. Obviously, when conditions pose a significant health or safety risk, we're not saying that you have to take the children out. Angie, is that an old hand or a new hand? Kristen?
So just some clarification, because I'm a single provider, and this is a new rule for us. So all children must ensure daily outside play for each child. What is the definition of significant health or safety risk? Being a sole provider, if I have a child that's not feeling well, am I still supposed to take them out on a rainy day? Because that's not really a significant health or safety risk, but I have no other option. I can't leave the one child that might be feeling a little under the weather, have them inside while I have to take 5 other kids outside by rule. So I'm not sure what you guys mean by significant health or safety risk in this rule.
And Abby, I'm gonna let you take that.
I will say that in the section that we had previously, I'm not sure if it's under policies or I can't remember what the section is, but we really kind of lay out what significant weather related things could be, which could be, I believe it's weather under 20 degrees or over 100, lightning, hail, like I don't think hail's included in there, but there are some
Tornado.
examples of tornado, air
Right.
quality emergencies. So things like that we would be and there could be other environmental factors that could pose a risk to children's health, which but we don't put them all in rule.
Right.
But for
This-
your
I-
specific situation about like a child being ill, that and then being the only caregiver, that's a kind of a different situation, right? Where you would need to be responsive to that child's needs.
Mhm.
Right. Just saying, as a sole provider, which a lot of RFs are, this might be a
Mhm.
hard rule.
Okay.
Because there's, there might be a circumstance with one child that might be that one child. Or if you had infants, are you supposed to take them outside with your preschoolers in the rain? If it's raining out, there's no other option, either all in or all out. So this just might be a hard one for
Okay.
solo providers to do.
Okay,
Thank you.
that's great feedback.
And Annalise did ask and I hope we answered this. It says, how is significant defined, and then how is it different from substantial or reasonable?
Okay. And Angie, your hand is still, do you have a question? Okay. Okay, I'm gonna move us on because I'm wondering if Angie's hand is, or maybe she's having some technical difficulties. So again, this general requirements for the care of infants and toddlers. This section is exactly the same as registered home. So we are just going to review this section. And the call out here, as mentioned in our last meeting, the term play yard means a playpen or similar type of equipment. And CCLD has a guidance document that does clarify what a play yard is. And we do have a template available to help support developing these plans or to collect the information. Sarah, you have a question?
Yes, on number 5, the items listed there are similar to the ones that are listed, I think, in the infant toddler equipment requirements. So I'm curious if there may need to be more definition around what is prohibited, just to be a little bit more clear. I think the infant toddler area said like jumpers, and then this says bouncers. So I guess just some clarity for me might be helpful.
Okay, great. Maybe a technical assistance document that shows the difference between the two.
And I think the jumpers is the this type of restrictive infant equipment is allowed, but they can only use it for a specific amount of time. Versus like a doorway jumper is actually not allowed in care, similar to a what is it? The thing with wheels that rolls around. The walker, like an infant walker, those are not allowed at all. But these types of things are. And that might be the difference. So when we get to that section, we'll see if that helps clarify, but for you. But it might be something, yes, that a TA document, technical assistance document might be helpful too.
So I will move us on. Okay, we have a whole new section. So CCLD, we now have specific requirements on the storage, preparation, and feeding of human milk or formula to infants. When human milk is served, here are the guidelines that must be followed. Yes, Annalise?
That part about the infant formula cannot be.
we changed combined in a bottle with cereal.
Okay, because I was like,
Yeah, yeah, yeah.
cannot be with cereal, fruit juice, or
Yes.
other foods. I'm like, I just wasn't getting it. I'm sorry, and
No,
I'm not
you're
able to
good.
see that on the screen. So it's the infant formula can be mixed with cereal, fruit juice, those kinds of things. If it's served in a bowl with a spoon, it just can't be used served in a bottle, right?
In a bottle.
Correct.
Choking.
Mixed with those things. So cereal.
Exactly.
Okay. Can you, so I guess I'm not clear. I just want to make sure that I'm understanding what this says. So infant formula can be served by itself in a bottle. It can be mixed with cereal in a bowl. Fruit juice could be served to an infant without being mixed with infant formula.
So the infant formula cannot be combined in a bottle with cereal, fruit juice, or other foods without a medical practitioner's written permission.
Do people actually mix formula and fruit juice?
I don't know.
Like,
That's a good question. I
mean,
don't.
do we even need a rule about fruit juice? Because what I'm wondering is, okay, is the rule you're trying to write, infant cereal cannot be served from a bottle mixed with breast milk, infant formula, fruit juice, or any other food? Is that what this is trying to accomplish?
I'm gonna kick it to Abby, but I believe
I believe, yes, that is correct. This is something, it comes out of the specific division of caring for our children that speaks to obesity and food and things like that. We could definitely go back and look at their recommendations. We actually had some follow-up questions for them specific to this rule. And just get some clarity for you, and it may need to be reworded to make it clearer. Because I could definitely see why it's somewhat confusing but the intent is that we are not mixing formula with other things in a bottle and serving it to a child. That is.
so. I'm gonna.
There is we have 30 seconds left. Sarah says there's a suggestion on B that says once warmed, a bottle must not be, suggestion to add a 1 hour limit on how long formula bottles can be used. Yes, and Annalise says, yes, I recommend infant cereals should not be served by bottle. Okay. Thank you. Yeah.
And then this is the same section, but it is less. It's a condensed version, and this is for registered home. Okay. Oh, Annalise, do you have a question?
Yeah, because I knew it was coming up, the registered family, are we not, where is the rule that says that a registered family provider is not serving infant cereal through a bottle? I'm sorry, I'm not finding that.
We don't have that in the registered home rules.
Okay, so
And
my
Abby, I don't know
question
if you want to
would be,
speak to that.
since all children are the same, and infants, whether they're in registered family or certified family or centers, this rule really addresses children and child safety. So why would you leave that rule out from registered family and include it in certified family? That doesn't seem to be very logical. So I guess what I'm saying is we either need to take it out of certified, or if it's that important, we should be adding it to registered family.
Okay, great. Thank you. And Abby, I see a comment come through. You're muted.
I'm muted. Sarah says, on the same note, I'd suggest adding the hour limits for bottles and RF as well, as it has to do with health and safety.
Okay. Great. Okay.
Can I add something really quick? Sorry, I am on my phone and I don't up. Anyway, shouldn't be the rule exactly the same in this case, feeding infant and toddlers exactly the same in RF and CF for the reasons that Annalise just mentioned?
We'll definitely bring that back to the rule group. We've captured that in the notes and we'll revisit that definitely. We will transition into furniture and equipment for infants and toddlers. So I do want to highlight that this is a potential fiscal impact. Each crib, portable crib, or play yard must comply with CPSC standards for use by infants and have documentation from the manufacturer or retailer stating that either the crib was manufactured after 2011 or the play yard was manufactured after 2013. So if by chance providers have to replace an item, there is a potential fiscal there. I want to call out that we do have a rule now to support traditional indigenous practices. And a provider can allow for cradle boards or other traditional indigenous sleep equipment to be used as a sleep surface for infants. And that there's just a caution here that you must be careful to not overbundle or overheat an infant while using the equipment.
Carol, there's some comments. There are a couple of folks that agree that the infant and toddler feeding should be the same for both types of care, also including regulated subsidy, which is known as RS.
Okay.
And then Danny asked, do we know how many providers may be financially impacted by replacing these items? And Danny, I can actually speak to that. And it's very few, if any. Back when CCLD, prior to being ELD, and it was back with I guess it was CCD, Child Care Division. There was a lot of outreach done to providers in 2011 to ensure that they were aware of the new requirements for cribs. So this happens if like there are people buy resale items, that could be a factor. But there was a lot of emphasis on this in 2011. It's just now in rule now.
Okay. So I do want to highlight that B here, that is 1 1/4 inches. Sometimes information doesn't always transfer correctly. And Sarah, here is what Abby was talking about items that have been identified as unsafe. So we have the baby walkers, the doorway jumpers, things like that. So a TA document could potentially address some of that to help clarify. Okay. And I'm gonna go here. Up. They're exactly the same. Have to remember my little code here. I already forgot about it. Any other questions or comments, Abby? Okay.
Nope. Annalise does have her hand up now.
Oh, sorry, Annalise, I didn't see ya.
Yeah, no, that's no problem. I was just gonna drop in the chat. If there is a sleep practice that is traditional to another culture, but is not traditional to the indigenous culture, what do we do? What are we doing about that? Because I have some families that are not white who have other cultural traditions, and they're not going to be happy with this rule change. And I get it, right? But I just want to call out that we have a lot of different cultures in this country. No one culture is more important than any other culture.
Mhm.
What should I say to the parents who are maybe perhaps Vietnamese, Pakistani, African, recent African immigrants who have other cultural sleep practices that I'm not allowed to implement, but they see this rule change and say, well, that's not right, because what about my culture?
Mhm. I believe that you could help and file for an exception for an alternative sleep position. But I'm not sure. I don't know, Abby, do you want to add anything into that?
I know that this specifically is in rule because of our partnership with tribal representatives and tribal nations. And it is across all license types to make this allowance. In terms of other and really supporting, Native culture and Indigenous culture within childcare. I agree with Carol that like you can always apply for an exception. And it would be looked at on a case by case basis. But we could definitely, of course, take that feedback that there are definitely probably other sleeping arrangements for infants that exist in various cultures as well. So it should be considered through an exception process as of now.
Was there a comment that just came in, Abby? I can see a pop-up sometimes.
Yes, it says, Annalise says, right, but what about other cultures? And it isn't about the rule, it's about one group getting recognized, but ignoring other cultures. It's about equity, inclusion, and equality. Yes. And again, we'll take that back.
So we are right at 7 o'clock. So we can take a 5-minute break and we'll come back to the diaper changing and toileting. So see you at 7:05. Oh. Yes, Sarah.
Unsure if this is the appropriate place, but I'm from a state where we would wear gloves for everything. And I don't know if that's a consideration, wearing gloves for food prep, breast milk, diapering and things like that. It does have a financial impact, however.
So with certified homes, the environmental health specialist has not ever suggested that we make those changes in our rules, but we definitely would we can take that forward and put that suggestion, take that feedback forward. One item I want to call out here is that we did remove that the surface must be large enough to accommodate the length of a child with protective edges or barriers that prevent a child from rolling or falling from the surface. And we also removed that the requirement of a safety strap or harness must not be used on the diaper changing surface. However, children must never be left attended on the elevated changing surface. So that rule helps with those two. Got a lot of reactions going on.
I know. I'm so sorry. That was me. I'm out of control over here. I have one quick question on that last section, if we still have time. Is there, I know that obviously you're gonna change out any sign of a wet or soiled diaper, but there's no requirement that there is a, that they need to be checked like once an hour or something?
No, it's so we put in here that diapers must be changed when a child exhibits behavior that suggests a wet or soiled diaper. So that really helps. It's kind of like on the child schedule. So are you suggesting that maybe that would be a good thing to add in?
Well, yeah, I mean, I'm just thinking about like from my experience as a foster parent, like you could have a kid that is entirely like nonverbal or wouldn't give typical cues that another kid would give. And so like if the kid hasn't exhibited a sign, I think it's helpful to check a minimum of once an hour or when the kid exhibits, or whatever the appropriate rule would be, just to, I mean, a caregiver is going to do that anyway, but if we're
Yeah.
it's kind of a common sense thing, but just to, I don't know, be really thorough, just to maybe an idea.
Okay, that's great feedback. Thanks.
The chat says Vanessa says that she agrees, and then Sarah says maybe add or every blank hours.
Okay.
Yeah. Thank you.
Okay, we have another. This is exactly like registered home. It should be super fast here. This just covers what must be cleaned and sanitized. There's no questions. I'm gonna. Oh, looks like something came in.
Says Flora's suggesting, I think this is back with diaper changing, or it could say something like before lunch, after coming in from outside. So giving like a suggested schedule for checking on diapers too.
Okay, great. So if there's no suggestions on the cleaning and sanitizing of infant and toddler areas, I'm gonna move us forward. So this section covers behavior and guidance. So a provider needs to have a written policy on behavior and guidance that's simple and understandable to the child, the parents, and all caregivers. And this covers what needs to be in that. One call out here is this 3, that a provider must ensure that only caregivers shall provide guidance to a child. We are going to add in educational coaches to this requirement. And I do want to highlight number 5 as an equity issue. Yes, Vanessa.
For number 3, where you're gonna include educational coach, is educational coach defined in the definition section?
It is not.
Because they don't call them education coaches everywhere. Like here, they're called teachers for like ECI, or or if I have ECI come in and they're counselors or teachers or aides. So not everybody's going to know what an educational coach is. So
Okay.
maybe pulling that out a little further.
Okay. Great.
And Sarah makes the comment that some agencies are not allowed to work with children and only adults. Yes, so they only provide consultation and assistance to adults and not children directly.
Move us forward. Again, this is the same as in registered home. This covers prohibited discipline and actions. This is what is not allowed. And I believe much of this is the same as what is currently in rule for certified home. Yes, Vanessa.
On number 4, where it says confining or isolating a child to an enclosed or darkened area, maybe it's something that needs to be an exception rather than in rule, but sometimes sensory areas need to be darkened for children who are overstimulated.
So this is specific to prohibited discipline and actions versus this is basically saying you can't place a child in there for discipline purposes.
And I understand that, but sometimes it can be taken as if a provider is removing a child that is clearly overstimulated and not, they are removing that child to that area.
Okay.
And if somebody is in the home that's, not necessarily educated, they might take that as discipline.
Okay. Okay. Good call out.
And Angela says, in other words, can't use the dark for discipline, but can use for support. Is that what you're saying? So, and Vanessa, I don't want to speak for you on that part because.
Yes, that's what I'm saying.
Okay.
And Annalise?
If you could not move that up next, it's really hard for my eyes to follow it because I want to read from it. Sorry.
No, that's fine.
On item number 3 there, using unauthorized prescription or non-prescription drugs or chemicals for discipline or to control behavior. One, the way that's written, might not be clear. Whether it's unauthorized prescription or any kind of non-prescription drugs. I would recommend for clarity to just say using prescription or non-prescription drugs or chemicals or supplements.
Okay.
For discipline or to control behavior, because here's the thing. Are we saying that if it's authorized by the parent, by a nurse practitioner? I mean, are we gonna allow people to use chemicals, supplements, melatonin? You should just put melatonin and Benadryl in there.
Yeah.
No, seriously. I mean, you just should.
No.
Because those are the 2 most frequently used supplement chemicals, for discipline or to control behavior. So if a parent is able to talk a doctor into having me do that, I mean, that's just not okay.
Okay, great. We'll take that feedback forward. It's a good call out.
And then Sarah just says melatonin, for example.
Okay. I'll move us forward. Okay, this is another section 2 that's both for registered and certified home. So I do want to do a little call out here that this is a totally new section for both registered and certified home. This may never happen in your program, and you may never have to physically restrain a child, but if you do, these are the requirements that must be followed. And again, these are the same requirements that are in center rules. And so we'll just go ahead and look at this. Here's when it can be used, when a child's safety or the safety of others is threatened. And the provider has complied with all elements of the behavior and guidance listed in the behavior and guidance rules section. One call out here I'd like to do is that if the physical restraint is used more than once on a specific child, that the provider must develop a written plan with input from individuals who have knowledge of the child's behavior. And you also need to notify your CCLD licensor when a written plan has been developed. Yes, Danny.
Hi, I just have a question more about like how this would be handled in practice, because I've had kiddos who have significant difficulty self-regulating and need to be held to self-regulate. Like I had a kiddo who had Asperger's who, like, a part of their plan was that I would hold them and like squeeze them until they calm down because they
Deep
need
hugs.
pressure
It's
on
called-
their central nervous system.
It's called deep pressure.
Yeah. And so I'm just wondering where like that kind of thing fits in here, because it could be seen as physical restraint. That was not the point of the exercise, was not to physically restrain the child, but to help them suppress their own nervous system and calm down.
Okay. And so for that child, you most likely would have a special plan for them. So that's kind of that kind of folds into this as well.
Thank you.
Yeah.
There are a couple things in the chat, but they're in regards to the previous rule section. So there's just Angela has a comment that some kids may be on prescription medications for conditions such as ADD or ADHD, where medication may be specifically intended to help them regulate behavior, but that would be separate from discipline, I think. And that would the answer to that would be yes. And then Annalise just said prohibits supplements such as melatonin, and our great note taker Al is capturing all this for the notes.
Hi, guys, this is Angie. Before we go on, I did have my hand up and maybe it wasn't seen, and that's okay. When we're talking about 3, where it says that we may not use blankets or weights, there needs to be some very specifics here, because children who have sensory integration dysfunction, autism, even ADHD often utilize weighted blankets as a way of self-regulation. And that is would not be considered a physical restraint, but in this case it is.
Okay.
And also, I think if DELC is wanting this to be implemented, it would be really beneficial for those of us who have children that we may need to use physical restraints, is if you would put on or find us a way to get OIS training so that we could do the restraints properly and have the correct guidance.
Okay, great feedback. Vanessa?
Along the line of weighted blankets, I would add weighted vests and compression blankets or compression sacks. Because with this rule written the way this is, I would have to eliminate 90% of my sensory program for the 6 children in my program that have autism.
Okay. And Angie, your hand is up. Is that a, oh, okay.
Oh.
Oh.
It is up. I don't know.
Is it lowered now? Because on my side it says lowered.
No, it's showing
I can,
raised.
I did it for you, Angie. I don't, it was
Oh,
still
okay,
showing as up.
okay.
I've got you covered. I just want to make sure you
Oh,
didn't have anything
thanks.
else.
You know, this late in the day, it's lucky I even know what my hand is.
We got
Uh,
you covered there, Angie.
And I want us to, and I don't think we're gonna get, I don't know if we'll get to it in this day, but because I'm hearing a lot of concerns about that part of this rule specific to what it sounds like plans of care for children that may have very specific needs within your program. And we should, when we get to the section on care of children with specific needs, we should see if some of this is reflected in there as being allowed and not an aspect of physical restraint. So, but that's definitely something to keep our radar as we move into that section too, because we may need to go back and reconfigure some things if it doesn't seem like that would be allowed or it would be considered physical restraint.
Definitely. So I am gonna move us forward. So we do have under the certified family rules, home capacity. I do want to highlight that in here we did remove the two toilet. I believe this is where it is, or maybe I'm off a section.
It would have been in this section if it had been a rule. You are correct, because it would have had an
Oh,
impact
that's
on
right.
capacity of the home, but
That's
it's not in there because
that's right.
it no
'Cause
longer
we-
does.
Yeah, yeah, exactly. Thank you very much. So, so we did, like I said, we did, I do want to highlight that we did remove that one toilet, that one additional toilet that was needed in order to get to a capacity of 16 children. So now providers just need to have one toilet and you can have, up to 16 kids. Reason being is many times you have infants that don't use a toilet at all. And it did limit quite a few people that maybe had the square footage in order to accommodate the extra children or extra child rather, but they couldn't just because of something that was beyond their control. Many of these rules are the same as the existing rules, but they're just packaged in the same section versus spread throughout the rules. I'm going to switch us to registered family because the rules are different. So I'm going to have to scroll. So just want to give you the heads up that if you get sick like I do watching the scrolls, let's see, scroll too far.
No, I don't think our registered
Oh.
family has home capacity because
Oh, okay.
they have 10 children. So
They've got
their
10
square
children.
footage. Yep.
Thank you very much. I wonder why I couldn't find it then. So moving on to the home structure and safety. So I do want to call out that we removed the requirement that if a home is not the residence of the provider or a home located in a zone other than residential or commercial, that local planning and zoning occupancy and building code approval is necessary. So we did remove that.
I also want to call out that also in this section, I believe A is also removed, which says it's located in an area zoned residential or commercial, along with the definitions of residential and commercial. But B does still remain a building constructed as a single family dwelling or other dwelling.
We do have some additional exit requirements, and those are in more in line with building codes. Oops, sorry.
I do want to call out, this is kind of, exits are kind of my section in rules.
They're
that
Abby's jam.
these requirements are specific to either if there's a change of address or if a newly licensed home after July 1 of 2025. So programs that are currently operating can operate under existing what we term usable exit requirements. And so these new rules on exiting are for new programs or new homes.
Yes, Angela.
I was just wondering if there might be something maybe in another section that would deal with locks anywhere about having like child safety things to prevent a kid from being able to open an exit door.
Oh, not, I don't think in, Abby, you know this section better than I do.
Well, I have a follow-up question. Are you asking if they're allowed to be used?
Are there any requirements that a door to an exit would need to be child safe?
No, there are not. And I would tend to think that an exit door needs to be easily accessible so when evacuating the home. Though this does not, I do not think that these rules would prevent someone from putting on like a doorknob lock as long as it's easy to I think it says no special knowledge or key.
Current adults.
Yeah.
The reason when I was getting licensed as a foster parent, we had to have that on exit for having kids in the home. So it's interesting that providing care just in a different faction. You would think you don't want toddlers being able to get to an exit, but just curious.
And Sarah asks, are keypads allowed from the inside? And we have not been asked that, Sarah. We'll have to research that. Like a code, like a key code.
Yeah, for safety precautions.
Okay.
The kids.
We'd have to ask. Yeah, I'm not sure.
We do have some specific requirements about portable electric space heaters. One thing I do want to call out here is that we do have a range for indoor temperatures, no lower than 68 and no higher than 85. However, if you're unable to maintain those internal temperatures, you must just use strategies to help children stay warm or cool. So that looks like extra water. That could be airing the house out in the morning, closing up in the afternoon. And so, but we did put a range in there.
Sarah asks if there's a water temperature maximum. Sorry if that's another section. Do you mean for like hand washing?
I don't think so.
I don't know. We'd have to look at our OHA feedback too to see
Yeah.
if there was a maximum on there. There's one comment that says, Annalise says must isn't the correct word then because two parts conflict, so strongly recommend or should to the extent practical. And I think that's in reference to 13. So
13?
we'll make a note of that. Yep.
So we have two potential fiscal. So vertical blinds need the tie down devices to hold the cords tight. Or they need to be out of reach of children. And if you have any indoor platforms or lofts, they must have a protective barrier.
And Angela says, just in reference to the water temp maximum, if not there, it makes sense to me that the setting on the hot water heater should have a maximum to prevent accidental burns. And then Mindy says, when we have a sanitation inspection, the person doing the inspection does check the water heater for a temperature.
Okay.
Thank you, Mindy. But we will double check on the water.
So the home structure and safety is a little bit different in registered home.
Annalise says, second floor above, what if all floors exit directly to ground level because of terrain? I'm not, Annalise, is this in reference to which rule? Sorry, I want to make sure.
Sure. So if we
Weird.
scroll back up. Stop. There you go. 8. 8A and B.
Okay.
Well, and C.
I actually don't know the answer to that question either. And this currently exists in rule. So if
Right. That's my whole point.
yeah, and I can't speak to that question. I would have to go back and probably ask our team and our field staff team about how this works.
I mean, I can tell you how it works at my daycare, but I don't know that it's uniformly I don't know if there's consistency across the state. Let's put it that way.
Well, we can definitely take that back.
Definitely. With the same requirements for the space heaters. Same verbiage about the indoor temperature, which we captured the feedback regarding that. And then the same requirements for vertical blinds and indoor platforms. Okay, I'm gonna move us along. And close your eyes if you get motion sick.
Annalise does have her hand up too.
I'm
so-
sorry, I didn't see you. I was.
That's all right. I also just want to point out that, and I think because I've been licensed in other states and I work with providers who are licensed in other states currently, right? There's a pretty large group of us from across the country that talk regularly. I think a lot of states have shifted away from calling it second floor, first floor, basement, that kind of thing. And they start talking about if the egress is a certain number of feet below ground or above ground. So like the windows that open and things like that, on like a second floor or in a basement or something like that. The discussion is above or below grade,
Okay.
right? Or ground level.
Ground level.
Because if my second floor, if because of the way my house is built into the side of the hill, if I'm up on my third floor and the window is on the third floor, but the ground is like 1.5 feet underneath the window on the outside, right? So some of this, and it just the experience that I've had with building codes people, some of the licensing rules don't just, and we know this, right, from the DLCD work group, just don't jive with building code.
So this section covers a lot of the lead testing requirements and explains that process. Yes, Angie.
So I know somewhere in this rules section, it talks about having the well tested for E. coli, but it is not clear in our rule book how often we are to test.
Okay. So the new rules do address that.
Oh, yes.
These
sorry.
rules do. We read your mind, Angie.
You knew where I was going to be because it's just been very confusing. And even our sanitation guy was very confused by the rules. And we've talked to our licensing specialist about it in the past. And I know she's gone to her supervisors and we've just never been able to get clarity. So I'm hoping that maybe this is clearer than mud.
let's hope, okay? When we get to that section, we want your feedback.
Okay.
And here we come, Angie, about using a private well.
Well, bless your guys' heart. That is clearer than mud. Thank you.
Oh, that's awesome. I'm gonna switch to the registered home. This does read a little bit differently. The first part is the lead testing. And lead testing is the same, except for no, I think it is the same. And I don't know if there are any people who are registered home providers on this call tonight that have a private well. But if so, here are the rules for the testing that must be done. There are no questions or comments. I'm gonna move us on. Oh, something just came in.
Fernanda asks, what if it's spring water? Is also testing necessary? I live in a rural area, so I'm wondering. That is something I think we would definitely have to reach out to the folks at OHA who provided us with this guidance to figure out. I know that lead testing would be required, but in terms of the well testing, we'll have to do some research and get back to you.
Okay. And I think, did something else just come in?
Just a thank you.
Okay. And so, this is our last section to review tonight. This section is written exactly the same for certified and for registered. It is a short section, and here, stop here. So here is the toilet, hand washing, sinks, and bathing. This is where it says that a certified family home just has to have one flush toilet and one hand washing sink available to children at all times. Any questions or comments regarding this section? Well, if not, I want to thank you all tonight. I know we went through this information very, very quickly. Please, if you don't feel like you had an opportunity to voice your thoughts or feedback, please use that feedback form that we have that's been included in the emails. We really want your feedback. We're reviewing every piece that comes in, and so it's really, really important that we get that. And so if there is no other questions or comments or concerns, you are all free to go about your evening. Yes, Annalise.
Hey, so this isn't like me arguing with the or taking issue with a rule. And I know the rule about having toilet paper at the toilet has been there for a long time. But does anybody, it's rule A underneath the pink, right? Toilets must be supplied with toilet paper. Like, does anybody know the story of how that like actually got in there or why that is in there? Like,
You know, Annalise, I don't, and I've been licensing
I
for
mean,
a
who hurt
long
that
time.
person? Right? I mean, like literally, who hurt that person? Because that toilets must be supplied with toilet paper. That just seems so very basic. Does anybody at Dale know if anyone is, I mean, I'm just out of curiosity because we are scheduled till 8 o'clock. And so I thought, well, I've got a couple minutes extra. I'm going to ask, is there even ever a record of anybody, of any childcare program ever being cited for not having toilet paper?
I can't speak to that because I don't know statewide. I just can't speak to that. I don't know.
I can say I have received a complaint when I was a licensing specialist that a childcare facility did not have toilet paper. But
Oh my God.
it was invalid. But there and but Ronnie mentions that this is a pretty common rule across states. It does seem very just common sense and logical. But there are, I will say, a lot of rules that should be common sense and logical, right? So,
And Angie?
Okay, so Annalise, I can help with this just a little bit. Many years ago, there was this big movement, and some providers were utilizing washcloths in their bathrooms so that children who had bowel movements could utilize a clean wash rag and then put it in a diaper pail that could be washed at the end of the day. For those of us who are certified, that kind of fell underneath some of our sanitation issues. And so there were a few providers who were upset that they actually had to start supplying toilet paper. No joke.
Okay, that's keeping Oregon weird. Yeah.
Wow.
Okay. All right, good,
Thank
good.
you for
Because
that
I'm like,
frame up, Angie.
I came from a state where that was never
Sorry,
in
guys,
the
it's
rule.
true.
Because everybody assumed that like providers, the kids were going to have toilet paper. I mean, wow, that's shocking. Thank you for sharing that because I've always wondered, why is that a rule?
There are a lot of comments in the chat around this too, and some of them are very valid. Like people hearing of people that are not stocking their bathrooms or classrooms, they could run out. And then of course there's the yuck comment about the washcloths. And then during COVID, it was hard to buy maybe. But there are definitely a lot of yes, interesting situations out there.
Okay, because that just blows the mind. And every time I see that, I have to chuckle because I'm like, oh my God, who hurt this person that they put this in the rule? All right, well, good deal. Now we know why they have a toilet paper rule because people apparently didn't have the common sense to have, kids.
And we get to end our meeting on a chuckle, on a high note.
Yes.
So thank you.
Right. Carol, did you want to let everyone know that you won't be here next week?
So I won't be the facilitator for the next session. Ronnie Pham will be, and so she is you're in very good hands with Ronnie. And but all information, pre-information, things like that will come out from me. So we'll make sure that that you guys have all the information you need to know
Mhm.
for the next meeting.
Okay. All right. Have a good evening, everyone. Thank you so much.
Thank you.
Thank you.
Bye.
Bye, thank you.